Hi everybody and welcome to the news from the ANU Medical School from today, the 14th of August 2020. You would have seen the changes to the recommendations for people travelling to and from the ACT. The travel restrictions from Victoria stay in place. There have been new hotspots identified in New South Wales, and those of you who've been in those hotspots, you need to quarantine yourself. However, people who've been in Sydney now cannot be on hospital or health facility grounds. So for students, that means if you've been in Sydney for the last 14 days, you cannot go into placements or you cannot attend your clinical skills teaching. And for those staff who work clinically, you cannot do so unless you ask for an exemption. My recommendation is to all students and staff that don't need to travel to Sydney, do not travel to Sydney at the moment. Students will be excluded from their placements for 2 weeks. And remember, if you have any symptoms, please go get tested. If you enter any ACT health facilities, please make sure you've got your green tick, get a sticker for the day, and you should be ready to go. We have also made the decision to continue to stay on level B restrictions for the medical school, which means we remain partially open, but most of the staff will continue to work from home. This is no change to the past 5 months, but given the situation as it's evolving in Victoria, and particularly in New South Wales, we thought it was safer to remain on that level. If you have any questions in regards to this, please contact your supervisor. And you may have also seen the recommendations on the ANU website about a COVID-safe campus, and that includes not just recommendations on washing hands and physical separation, but also now has a strong recommendation to wear a mask. This is not mandatory, but wearing a mask may help prevent the spread of COVID-19 in our community, and it's something that is recommended on Acton campus, and you may have seen our Vice-Chancellor walking around with that mask. New South Wales students, those of you who are rurally based, you will have to follow the New South Wales rules, and within a hospital you're required to wear a mask, and it's highly recommended now in GP practices as well. And in the ACT, please follow local guidelines if you're hospital or GP practice based. Now, Professor Gruen, the Dean of our college, had previously given a town hall about the medical school for the future, and this is just a little update. As you know, the Task Force 1, led last year by Professor Mitchell and Professor Kenny, defined the history, outlined the future health challenges, described a vision and an identity for the medical school. The job of Task Force 2 is now to be clearer on what that looks like, what the function of the school is, and that will eventually lead into a clearer delineation of the structure of the school. These meetings have started, and we will hopefully have a first report out in about mid-September, which will very much focus on the function, and then by the end of November, a report on the structure of the school. Members and key reference groups, as I said, have already met, and I will keep you updated on where we're going. For Phase 1, as you know, there are plans underway to start the clinical skills teaching, and that has started this week for the ACT-based students. But we are at the moment considering what to do with those students who are interstate, whether they're in Victoria or elsewhere. And we will inform you in detail on what that would look like, and where that teaching can be made up. We're also interested to hear from the Phase 1 students about the teaching that went online and whether we have fulfilled our mandate in regards to the learning outcomes. The link to the feedback is on Wattle, and can please as many of you as possible fill out this feedback form. This will inform our teaching for the end of the semester, but particularly for next year, given that COVID-19 will trouble us for quite a while and affect our teaching. For Phase 2 students, can I please remind you to contact your academic supervisor, and for those of you who are academic supervisors, if you haven't met or been in touch with your student, please do so and have a talk about how they're going and what we can do to support their learning. Phase 2 is now planning a catch-up block, and for those students that are in Year 4, we're planning the print term, which will be after the exams. We've also made the decision for the current Year 3 students who previously had been told that the electives were not happening this year to have voluntary electives. So if you wish to do a voluntary elective, you can do so. Just follow the usual process. You need to organise that yourself. But what we will need to do is for each placement, we will need to do a risk assessment to ensure that you're safe and that you're safe to return there. If you're not sure, please contact the electives team on this. Poll Everywhere is software that enhances interactivity, and the TEL team has previously sent out some information. We now have an ANU license, and those of you who wish to use this in your teaching, please do so using the ANU license. The TEL team also has recommenced their drop-in sessions. They start on the 18th of August and they run every Tuesday from 1 to 2 o'clock, and they're available via Zoom. And in September and October there'll be face-to-face sessions on Creative Zoom, shortcuts to video creation and online tutorials. There'll be more information in the newsletter. There'll be a link in the newsletter that's coming out next week. You need to register for this, please. The spotlight on teams this week is on our fabulous Indigenous Health team, consisting of Stuart Sutherland, Amanda Wingett and Kerry Sutherland. And they're an integral part of our team here at the school, but their teaching is also integral to the MCHD and the Bachelor of Health Science. For Aboriginal and Torres Strait Islander community and cultural connections are incredibly important and affect their well-being. And the Indigenous Health team, knowing about this and recognising this, has really developed a great way to ensure that being together and community spirit is held up during these difficult times. There's more to read on the fabulous team and what they're doing in general on our website. And there's some congratulations in order. First of all, to Toni Green, who's been awarded her PhD just last month. Professor Imogen Mitchell and Dr. Brett Schultz, as well as colleagues from the ANU Institute for Communication and Healthcare, for a grant that they've been awarded for the development of evidence-based end-of-life communication resources for doctors. And Ricardo Natoli, Yvette Wolf and Adrian Chionka got an award for the best poster at the International Society for Extracellular Vesicles Conference. Congratulations to all of you. In the media last week, we've seen Professor Christine Phillips in the Sydney Morning Herald and RN Live Matters, Professor Peter Collignon, ABC Radio Adelaide, and Associate Professor Sanjaya Senanayake at ABC Radio Herald Sun and ABC Radio Sydney. Now, at this time of the year, we're all very excited, usually, to see the Med Review night. So the Med Review is a review done by our medical students every year, with the income from those review nights to go to Companion House. Given the COVID-19 scenario at the moment, this cannot be held this year, but our fabulous medical students have made the previous Med Reviews available online. So you can see Bedside Story, Freaky MI Day, or How to Train Your Doctor online. There's a Facebook link there, which we'll also put on the newsletter, and the donations will also go to Companion House. So join the team online and have a great night watching previous Med Reviews. Those of you who were unable to attend the mid-year faculty meeting are now able to see the recording. This was available as a link on last week's newsletter. There will also be the ANU Virtual Open Week held on the 22nd to the 28th of the 8th. And whilst you might think that this is just for future students, there are actually lots of sessions there for current students and for current staff. Have a look when it becomes available on the ANU website, and you might be enticed to attend some of the sessions. A webinar running on the 18th of the 8th. Now be aware, this is London time, so here it'll be 11 p.m. We'll discuss the reporting guidelines for animal research. And just for those of you on main ANU campus, please be aware that ITS will update the university phone system this Saturday, tomorrow, the 15th. And if you have any issues with your phones after this upgrade, please log a job with the service desk. So this is all from me for this week. What we have decided is to alternate the video with the newsletter on a week-by-week basis. So you get the newsletter every fortnight and this video every other fortnight. If you have any good news, anything to share, anything you'd like us to comment about, please email us. In the meantime, I hope you have a great weekend. Please stay safe, look after yourselves, look after your friends and your family, and I shall talk to you via this channel again in 2 weeks. Thank you and bye-bye.